You are listening to The Scope, Phelps Health Podcast, Episode 17. Today we're discussing COVID-19 updates. Let's get started. Hi everybody, I'm your host Paige Hyphen. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also follow us on Facebook, Twitter, Instagram, and LinkedIn. All links can also be found in the show notes. Now let's get into our show. Today our guest is Ed Clayton, President and CEO of Phelps Health. Today we're going to be discussing COVID-19 updates, which again is top of everybody's mind. So Ed, we're just going to go ahead and dive in with our questions.
Sure.
So Phelps Health has recently made the decision to roll back some of our restrictions, which were reopened back in June. Can you provide insight into why that decision was made?
Well, sure. Back when we loosened up some of those restrictions, it was because of what was going on in our community, the amount of COVID spread that was going on, and what was happening with our own internal operations. And over the past several weeks, what we've seen is, first of all, even though we're testing more people, we're also seeing a much higher rate of positives. And so back in June, it was about 1% of all the patients we tested had a positive result from COVID. Today, that number is up actually at 11.3% over the last 2 weeks. And so no matter what benchmark you use, that gets you into an area where you start to become concerned about what's going on in terms of COVID spread in the community. So that was a trigger for us. Also, we've had a few employees that tested positive. That has been a trigger as well. And also we've had, over the last few weeks, patients admitted for COVID, which we hadn't had really up until, again, the last few weeks. And very sick people. And so just that entire body of information plus what's going on throughout the state led us to decide, you know what, to continue to have a safe environment for our patients and our employees, and to create a safe environment in our communities, that we needed to roll back some of those restrictions.
So is this something that is more of a proactive measure at this point, or should we be concerned as a community?
Well, I would say both. I mean, I think I do think it's proactive, because anytime you can put some of these measures in to stop the spread, that's very positive. We've been talking about that since March, whether it's social distancing, whether it's hand hygiene, all those things, mask wearing, all those things are intended to stop the spread. But also, you know, the community spread, what we're seeing in the community, and that positive rate are certainly things to take note of.
Absolutely. So you mentioned community spread. Can you explain what that is for our audience?
Sure. Community spread has to do with really just what it sounds like. Inside our community, people are passing the virus back and forth to each other. A lot of times, if you went back to what was going on in May and June, we had people traveling outside the area and contracting COVID outside the area. But we're starting to see more of it just inside our community, passing back and forth to people we deal with on a daily basis, or people we have interactions with on our day-to-day basis. So when we talk about community spread, that's what we're talking about. It's more, it's not the exception. We're starting to see
more localized.
More localized, yep.
So what restrictions have been rolled back into place that our community should know about?
Sure, there's three things that we've focused on right now. The first that's most impactful to the community is our visitor restrictions. And so we've rolled them back kind of to where they were in April, where we were limiting visitors into our organization. Of course, patients are always welcome, but with a few exceptions, we're trying to prevent the number of visitors coming into the buildings. Again, that's to prevent unnecessary interactions. Some of those exceptions happen to be for pediatric patients, certainly an adult guardian or adult that is going to be with that patient is appropriate. In end-of-life situations, it's appropriate to have someone there as well. So, but again, the goal is how do we eliminate unnecessary interactions and keep people safe? So
with these restrictions that have been rolled into place, what else are we also doing?
So a couple other things. Early on, we completely eliminated meetings within the organization. We've loosened that up over the past several months as, again, our environment indicated there wasn't a lot of community spread. Now that we're seeing that again, we have gone back to trying to minimize the number of in-person meetings we have within the organization. So we are once again becoming big users of Zoom, like a lot of other a lot of places have nationally. Again, just to try to minimize unnecessary interactions, which could potentially spread COVID. The other thing we've done as an organization, we had loosened for some of our employees that were in work areas where they could socially distance.
Mm-hmm.
We had loosened the requirement for them to wear masks in those situations. And just because of what's going on with community spread, we felt it was necessary to go back and to ensure that all employees, regardless of whether they're they have social distancing in the organization or not, are wearing masks. So even if we were 6 feet apart or more than 6 feet apart in our organization day, we would still be required to mask, just that extra level of safety to make sure that we're not spreading COVID to our coworkers or our patients.
Absolutely. Is it still safe to visit Phelps Health at this time? Should we still go to our appointments?
Yeah, we absolutely. And in fact, we're doing this to maintain the safety. Mm-hmm. Certainly, these restrictions that we have in place are absolutely intended to keep our patients safe. We've been talking about we're safe, we're open, and we're ready to serve you, and those things still all apply.
Yeah, they remain true, correct?
Yep.
How long will our visitor policy last? Do we foresee this into the fall?
My approach with this is to kind of look at it in 2-week blocks. And so I gave you that positive rate at 11.3%, which is above where we'd like to see it in the community. And we'll be monitoring that on a 2-week basis, and we'll make decisions off of that. So, we're in late August now. I believe this will go into September. We'll have to see what's going on in the community and our surrounding communities as we get towards the end of September and October. And we may find that we can, again, loosen up things, or we may find we have to be more restrictive. We're going to let kind of the situation dictate what we do.
Absolutely. And you've mentioned this before in multiple podcasts and interviews and memos. This continues to be a very fluid situation. So I think the 2-week time frame that you continue to preach, and you've preached this since March, is a great time frame because we just don't know what's going to happen on a week-to-week basis.
Yep.
So the next question I have is, what steps can patients take who have an appointment? What can they do to protect themselves whenever they come to Phelps Health for an appointment?
First of all, you don't need to come early. Show up at your appointment on time. Follow all the basics, so the proper hygiene. When you show up to our buildings, you'll be screened. And once you're past that screening point, do the basics. Maintain social distancing and mask wearing, which we require in our facilities. So doing those things will protect you and protect those around you.
So you mentioned masks, and a lot of people will notice on our last few podcasts, we've all been wearing masks to protect ourselves whenever we're interacting together and we're closer than 6 feet in distance. Why are we such big proponents of wearing masks at Phelps Health?
Well, at the end of the day, what we know, and there's a lot of unknowns about COVID.
Of course.
But what we at least have strong belief in is that the number one way it's transmitted is through respiratory droplets. And if you maintain a 6 feet distance, the odds of those respiratory droplets getting to someone else is minimized. The mask, when you're closer than 6 feet, helps prevent that transmission. And so we believe it's one, outside of complete social distancing, it's one of the best ways to prevent transmission.
Absolutely. And even in our exam rooms for patients, we're requiring them to now wear masks to not only protect the physician or the nurses, but really to protect themselves, correct?
To make sure, our employees, our physicians, and our patients, when they come to our organization for services, that they're as safe as possible.
And something else that we implemented, a couple of months back, are screening stations. Why are our screening stations so important as well during this time?
Really what those serve as is a first barrier to make sure that if there's the potential for someone coming into the organization with COVID, that we've at least tried to identify that early on and maybe prevent that person from continuing on into the organization and creating unnecessary interactions. The good news with the screening stations, when we do screen somebody and find them, we're able to redirect them to our respiratory screening area where they can be seen appropriately and safely, and so that's why we have those in place. It's really just to continue to make sure that everyone that's inside our buildings continues to be in as safe a position as possible.
Yeah, I think I go back to, we are always open, safe, and ready to care for you, whatever your needs are. It may look a little bit different. Right. You may have to go through triage and then go through a screening station, but we're still here for you at the end of the day, which is awesome. So speaking of services, will our services continue like normal for Phelps Health? I know we're pretty close to capacity right now, what we were before COVID hit.
Yeah, so right now, that's the good news. And it's well publicized. In March, April, and May, we had a significant restriction in the services that we were providing there. It wasn't because of our desire to see patients. It was because of the shortage nationally in personal protective equipment and certain supplies. And so we had to really, for the safety of everybody, restrict the services that we were providing. Today, we have plenty of that supply. And so we don't anticipate at this point having to restrict for those reasons. So our short-term and long-term goal is we're continuing to see every patient in a timely manner and making sure they're getting the services they need when they need it.
You know, with a rise in cases, do you anticipate that we're going to run short on PPE, or are we good to go?
You know, never say never.
Yeah, knock on wood.
But one of the lessons that Phelps Health, along with most organizations in the healthcare industry, learned is you need to maintain an appropriate supply because you don't know what's going to happen to that supply chain. So one of the things we spent March, April, and May doing is making sure we inventory plenty of supply so that if there is again a disruption in that supply chain, we can go a long period of time caring for patients with the supplies we have in a safe manner.
So will Phelps Health, as we continue to test more people, can we share that information about who tests positive and where they're from? And if we can't share it, why don't we share that information on our Facebook publicly?
Yeah, so we have limited ability to share that information. Our what we do as Phelps Health is we provide the testing service. What our local health department does is provide information to the community on the spread within the community. They do the contact tracing to identify if there's potential exposures and things like that. So one of the things we've learned as part of that is what's our role, what's the health department's role, and we certainly look to them to be the experts on making sure the community understands the transmission that's going on within the community.
Yeah, definitely. I think it's for sure, but it's a team effort between us and the health department to disseminate that information and figure out how we can work together to make sure that the community stays safe.
Absolutely.
So something that I always really love to hit on, because I think Phelps Health, personally, from an employee standpoint, has done a phenomenal job taking care of its employees. So Phelps Health still has been able to avoid furloughing any of its employees. So why is that, and will that continue?
Again, there's no guarantees into the future, but it was the reason we were able to do that is first of all, we for years, I've been here 19 years, and for years we have been reinvesting in the organization, but also you could say saving for a rainy day, making sure we had appropriate reserves. So if there was ever a disruption in dollars coming to the organization, that we could withstand something like that. And so where a lot of other organizations either don't have that foresight or don't have that capacity, we were in a fortunate situation when this hit that we could withstand a little bit of time where we could continue to pay our employees, making sure that they had work that they could be doing if they were choosing to do so, and not have to furlough. And so we are very unique in terms of healthcare systems and what's going on with that. And we've been very fortunate, and I think that's why we've been able to bring our services back so quickly, that those employees were here, and when the patients returned, they were ready to serve.
Absolutely, I completely agree. So, we're nearing the end of our show, but I want to give you an opportunity to share any final thoughts you have regarding the COVID-19 situation as it continues to be so fluid.
Yeah, again, there's so much unknown. Continue to do the basics: social distancing, mask wearing, hand hygiene, making sure that you avoid large gatherings. All those things we've been talking about for months still apply. And so just encourage everybody out there to continue to follow the basics.
Thanks so much for listening to The Scope. Today we've been speaking with Ed Clayton, President and CEO of Phelps Health. If you liked our show and want to know more, check out phelpshealth.com.